if you spend any time at all in,
Yeah.
wellness or fitness circles, you've heard the word inflammation.
Oh, yeah. It's the big one.
It's the big one. It gets blamed for absolutely everything.
Yeah.
Joint pain, weight gain, brain fog, you name it. And the advice is always just suppress it, ice it, avoid it, blend it away in a smoothie.
Get rid of it at all costs.
Exactly. But that raises a pretty big question. If inflammation is really this biological villain, why do we even have it? Why would evolution give us a core survival system that causes heat and swelling and pain?
Mm-hmm.
Is it a deadly flaw, or is it an essential tool that we've just completely misunderstood?
And I think that's the key. It's been misunderstood.
Okay, so let's really get into this. We've pulled together a whole stack of sources, randomized controlled trials, biological reviews, and our mission for this deep dive is to synthesize all of it. We want to draw a really clear evidence-based line for you,
Right.
a line between the beneficial, acute inflammation and the harmful chronic kind. The goal isn't zero inflammation. It's optimization. It's about getting your body's systems working when they should and how they should.
And that biological context is, it's where we have to start. Inflammation is not a mistake. It's not a defect. It is a highly coordinated biological program.
A program.
A program. It evolved specifically to protect our tissues, to fight off infection, to coordinate healing. It's fundamentally an adaptive response.
So the mistake is just lumping it all together.
Exactly. We talk about it like it's one thing.
Yeah.
But we're really looking at two completely different states. You have acute inflammation that's short-term, powerful, and adaptive. It starts fast, it ends fast.
Yeah.
Minutes to maybe a few weeks.
And the other one?
Chronic. And that's the complete opposite. It's persistent, it's low grade, it can last for months, even years. And that is totally maladaptive. It breaks things down instead of building them up.
Okay, let's stick with that first state then, the essential engine. Acute inflammation, this is the body's 911 call, right? So what's actually happening at the cellular level when tissue gets damaged?
Think of it like a rapid deployment force. The moment there's damage, your body releases these chemical messengers. They're called pro-inflammatory cytokines, things like IL-6, TNF-alpha.
These are the flares going up.
Exactly, they're the flares. And those flares call in the immune cells, especially neutrophils and macrophages. They rush to the scene to, clear out debris, kill any bugs, and kickstart the repair process.
So the redness and the swelling we feel, that's just the cleanup crew arriving.
That's the sign that they're on the job, yes.
But I think the part we always miss is the off switch. It's not enough to start the fire. You have to put it out.
This is where the science gets really, really cool. Acute inflammation is defined by what's called its resolution phase.
Okay.
And it's not just that things peter out. It's an active programmed process. The system goes through something called a lipid mediator class switch.
A lipid mediator class switch. Okay, that sounds technical. Break that down. What does that mean for healing?
It just means the body stops making the pro-inflammatory flares and starts creating these specialized anti-inflammatory agents. They're called resolvins and protectants.
Ah, okay.
And they're like the dedicated cleanup crew that comes in after the fire is out. They extinguish the last embers, they sweep up the debris, and they send an all-clear signal to the immune system.
But chronic inflammation is just a failure of that all-clear signal.
It's a failure of resolution. The system just gets stuck on a low simmer.
And we have really good evidence that if you block that initial necessary response, even if it's uncomfortable, you can actually sabotage your body's ability to adapt. And this is so important if you exercise.
Oh, absolutely.
Yeah.
The best evidence we have for this constructive role comes from resistance training. When you lift weights, you're creating micro tears in the muscle.
Right.
That damage triggers an inflammatory response, and that response isn't the source of the growth, but it is the essential signal for the muscle to repair itself and get stronger.
There's one key RCT on this that really spelled it out. They took young adults, put them on a strength training program. One group took high-dose NSAIDs, like 1,200 milligrams of ibuprofen a day. The other group took nothing.
And the results were, well, they were stark. The group on ibuprofen had approximately 50% smaller gains in muscle size.
50%.
50%. The drug literally blocked the anabolic signaling that's required for muscle growth. It stopped the satellite cells, the stem cells for muscle, from activating properly.
Just think about that. You put in all that work, but because you pop a painkiller every time you feel sore, you might be cutting your potential gains in half.
It's a massive trade-off. You're choosing comfort today over resilience tomorrow.
And it's not just muscles, right? We see this in other areas.
All over. If you look at acute infections, suppressing a fever doesn't actually provide any mortality benefit, even in something as serious as sepsis. The fever is the body's defense. Same with bone healing. A little NSAIDs is fine, but prolonged high dose use is linked to bones not healing properly because you're interrupting that critical first phase.
The message is just so consistent that acute response is there for a reason. Suppression has to be really thoughtful.
Exactly.
Which brings us to the other side of the coin, the chronic threat. If acute inflammation is a useful fire alarm, chronic inflammation is like the faulty smoke detector that's just beeping constantly.
Yeah, driving everyone crazy and sending fire crews when there's no fire. It's low grade, it's systemic, and it just grinds on for years. It's what scientists call inflammaging in older adults.
And it really seems like a problem of modern life, an evolutionary mismatch.
It's a textbook case. Our immune system evolved to handle a cut, a broken bone, a big infection. It did not evolve to handle 80 years of sitting in a chair and eating ultra-processed food. Those things are constantly poking the bear, triggering the immune system day in and day out.
And one of the most, frankly, alarming ways this happens is through the gut, a condition called metabolic endotoxemia.
That's right. So when your diet is poor, not enough fiber, lots of processed junk, it messes with your gut microbiome. That can compromise the intestinal barrier, the whole leaky gut idea. And when that barrier is leaky, tiny amounts of bacterial toxins, specifically something called LPS, can slip into your bloodstream constantly.
And the body sees that as an invader.
Immediately. It activates the master switch for inflammation, a pathway called NF-κB. So it's not a big acute attack, it's just this constant tiny drip, drip, drip poison, keeping the whole system on low alert.
That sounds exhausting for the body. We hear about the link to cardiovascular disease all the time, but is it just a correlation, or do we have proof that it's actually causal?
The evidence here is probably the strongest we have, and it comes from a huge study called the CANTOS trial. They looked at over 10,000 patients who'd already had a heart attack.
Okay.
And they used a drug, canakinumab, to specifically block one of those inflammatory cytokines we mentioned, IL-1 beta.
And what happened?
They saw a 15% reduction in major cardiovascular events, heart attacks, strokes. But here's the absolute kicker. It happened completely independent of the patient's cholesterol levels.
Wow, so it wasn't about the cholesterol at all.
It proved that inflammation, that specific IL-1 beta pathway, is a primary driver of heart disease. It's not just a bystander.
That is incredibly compelling. That feels like a smoking gun.
It is, but, and this is a really big but, the trial also uncovered a massive trade-off, a huge cautionary tale.
Oh.
While the drug did reduce heart attacks, the group taking it also had an increase in fatal infections.
Wait, really? So you solve one problem but create another equally serious one?
Precisely. So because of that trade-off, there was no improvement in all-cause mortality, no overall survival benefit. It's a profound reminder that you can't just switch off a major part of your immune system and not expect consequences elsewhere.
That complexity seems to be a running theme. What about in things like obesity and type 2 diabetes? Inflammation is always present there.
It is, but it's more of a chicken and egg situation. Some advanced studies, called Mendelian randomization studies, they suggest that inflammatory markers like CRP and diabetes might be, well, they're correlated but independent risk factors.
Meaning?
It means that while they happen together, one doesn't necessarily cause the other. So just lowering inflammation with a drug might not actually stop the disease from progressing. They might both be symptoms of the same underlying problem.
And we see that same disappointment in, say, Alzheimer's disease.
We do. Big trials using anti-inflammatories, like the ADPT trial, have consistently failed to show any benefit. The leading theory now is that the inflammation in the brain is mostly a downstream effect. It's the cleanup crew responding to dying neurons.
So you're trying to put out the fire after the building has already fallen down.
You're too late. Exactly.
Okay, so the picture is becoming clear. We need to support the good, acute, adaptive response while doing everything we can to minimize the bad, chronic, pathological state. Which brings us to what to actually do. Interventions.
And the foundation is, and always will be, lifestyle. There's no magic pill here.
So, exercise.
Consistent, regular exercise is probably the most potent anti-inflammatory we have. It lowers all the key markers, CRP, IL-6, TNF-alpha, and you really see the benefits kick in after about 12 weeks of consistency.
It's so elegant how it works, too. That short, acute spike of IL-6 during your workout actually signals an anti-inflammatory cascade later on.
It's training the system. You're using a controlled fire to manage the chronic embers. And of course, the other big lever is diet. The Mediterranean diet has the most consistent, high-quality RCT evidence behind it for lowering those biomarkers.
Because it's feeding the good gut bugs, right?
It's feeding the gut, providing fiber, and it's loaded with polyphenols. It just ticks all the boxes.
Okay, let's circle back to NSAIDs, because the age paradox here is, I think, one of the most stunning things we found.
It completely flips the script.
Mm.
We know long-term use is risky, and that in young people they block adaptation. But one study looked at older adults, people in their 60s and 70s. For them, taking NSAIDs actually enhanced their muscle and strength gains from training.
That makes no sense based on the other data. Why?
Because older adults tend to have a much higher baseline level of chronic inflammation, that inflammaging. And it seems that this constant inflammatory noise is actually what's stopping them from adapting. So by carefully turning down that noise, the drug, paradoxically, created an environment where the muscle could finally grow.
The same process is either helpful or harmful depending entirely on your starting point.
Exactly. Context is everything.
Which brings us to cold exposure. The ice bath. Everyone's doing it.
And look, cold water immersion is great for making you feel less sore. It works for symptom relief. But just like the NSAIDs, if you use it regularly right after a workout, it attenuates muscle growth. It dampens the signal.
So it's another trade-off.
A very clear trade-off. You feel better tomorrow, but you get smaller long-term gains. You have to decide what your priority is: immediate comfort or long-term adaptation.
Okay, finally, let's hit the supplements. Omega-3s and curcumin. The marketing is everywhere.
The omega-3 evidence is genuinely conflicting. Your standard off-the-shelf fish oil supplement, the big trials like Vital and Strength found they don't really do much for the general population in preventing major health events.
But there's a nuance there, isn't there?
A huge one. The Reduce-AT trial used a very specific ultra-high dose of purified EPA, 4 grams a day. And that showed a significant benefit in high-risk patients. So it's not just the supplement, it's the specific formulation, the dose, and who is taking it.
And what about curcumin, the wonder spice?
Curcumin has a massive bioavailability problem. It's just very hard for your body to absorb. So while some small studies show it can nudge down biomarkers like CRP, it just doesn't have the robust clinical outcome data. The marketing has gotten way ahead of the science on that one.
So when we pull this all together, we've got all this incredible nuance, but there are still some pretty big gaps in our knowledge.
Oh, huge gaps. We have no idea what the long-term effects, I'm talking decades, of these targeted anti-cytokine drugs are. What do they do to cancer risk, to infection risk? The CANTOS trial gave us a scary glimpse of that.
And we can't really personalize this yet.
Not really. We know everyone's inflammatory response is different, but we don't have good tools to measure that and say, you specifically should target this pathway. And we have no idea what the optimal level of inflammation even is. That Goldilocks point is a complete unknown.
So let's sum up the myths that our deep dive has busted. First, the idea that inflammation is always bad. It's not. Acute inflammation is vital.
Absolutely essential.
Second, the myth that just lowering a biomarker on a blood test means you're healthier. The NSAID story proves that's not always true. Sometimes you need that signal. And third, the myth that you can just pop a few supplements to make up for a pro-inflammatory lifestyle.
No. The foundation has to be lifestyle. You can't out-supplement a bad diet and a sedentary life.
Which leaves us with a final thought for you to take away. The question to ask yourself isn't, how do I reduce inflammation? It's which inflammation, when, and at what cost?
The goal isn't zero, it's efficient resolution. So next time you finish a tough workout and you're reaching for that painkiller or thinking about the ice bath, ask yourself, am I choosing comfort today over building real, long-term resilience for tomorrow? That's the biological trade-off we all have to learn to navigate.